Hi, my name is Amber Manna, and this YouTube video is on sex and gender. I'm going to talk about the differences between sex and gender and how, being a physical therapist, it affects the way I treat patients, and how can it affect the way I treat patients, and what is right and what is wrong, and a little education on that subject. So the first thing we need to look at is, what does it mean to say the sex of a person? The sex of a person means their biological makeup. Women have female genitalia and are made up of two X chromosomes. Men have male genitalia and are made up of an X and a Y chromosome. The difference is expressed hormonally and physiologically. There's a contrast. There are other differences also in women and men besides their genitalia or their breasts. Those things are the average weight, height, strength, and longevity. These differences are referred to as sexual dimorphism. Like I said, sex differences are biological. Gender means all the traits that a culture assigns to and ingrains in males and females. Tasks and activities assigned to the sexes are considered gender roles. It's very important to treat transgender individuals with respect and privacy, just as you would any other patient that you are treating. And this goes in for the physical therapy field, radiology, any type of treatment that you're giving that patient that is coming to your facility for. Healthcare providers need educated on how to properly deal with situations that may arise with transgender individuals. Doing so ensures that they have a pleasant experience in return for treatment. There was a Joint Commission report that was done that reported that lesbian, gay, bisexual, and transgender people are subject to substandard care, insufficient insurance coverage, and poor health outreach. Consequently, they get fewer preventative screenings and have increased rates of substance abuse, depression, suicidal ideations, and sexually transmitted diseases. So this is why it's important to overcome those healthcare disparities and treat everybody equally when they come to your facility, no matter what they are or what they identify as. I had one such incident that I'm going to do a skit on to show you what happened in my situation. It was uncomfortable. I did learn something from it. And I also learned that communication between the different disciplines in the hospital setting or any setting that you work in is very important when you're dealing with an individual, any individual, their feelings or their care. It's important that you communicate, number one priority in the healthcare industry, and you treat everyone with dignity, respect their privacy, and so forth. So I would like to introduce you to Conrad so-and-so. This is me, PTA, and this is our charge nurse. We're going to put the charge nurse right there for now. And here is Conrad so-and-so. Knock, knock, knock. Come in. Oh, hi, Mr. So-and-so. I'm Amber. I'm your PTA for today. We're going to move your, excuse me, miss. It is Ms. So-and-so. Oh, I'm sorry. I didn't realize. Give me 1 second. I'll be right back. I have to get some equipment. Charge nurse. I just went into a patient's room and it was Conrad so-and-so, and he corrected me and said it's Ms., not Mr. Oh, that's right. He goes by Connie. He had gender reassignment surgery and goes by Connie now. That's okay. Just go in and tell him you're sorry and just act like everything's normal. Well, I think everything would have been more normal and in place if I was told of the situation before. And if we would have communicated a little bit better, that would have been wonderful. Okay, I'll make a note of that. Thank you. Okay, Ms. So-and-so, I'm back. We're going to move your legs. Let me drape you first. Put the drape on you. There we go. We're going to do some exercises and we'll get you walking and back to normal in no time. How does that feel, sir? I mean, ma'am, I'm sorry. Please forgive me. I just wasn't told or I was under the wrong impression. That's okay. Okay, ma'am, I will see you tomorrow and we will continue to work on what we started. Thank you. Have a good night. Bye. First of all, I was uncomfortable because I wasn't told of the situation, and this woman looked just like a man and had the body structure of a man, longer hair, but I was assuming I was speaking with a man. So after being educated about it, and told, this is Connie, then I felt more comfortable, and hopefully she felt more comfortable with me after we kind of broke that ice and we continued with our therapy. It doesn't matter if she was a male or female. Was I caught off guard? Yes. Does that happen? Yes. Now I feel more comfortable to where I could handle the situation a little bit better if it happened again. And I would catch myself maybe not being as surprised. But I think communication is the key between healthcare disciplines. So everybody is on the same page and knows how to handle these situations appropriately. Again, every patient should be treated with dignity, respect, privacy, no matter what they identify as. It's very important. Thank you. I hope you enjoyed watching.